The CDC says the federal government has given California 3.5 million doses of the coronavirus vaccine, but only an estimated 1.3 million people have actually been vaccinated. And there is still a long road ahead to get people in California and in San Diego County the shot. Joining us now to talk about the effort to vaccinate Californians and San Diegans is Dr. Sabrina Fabi. Dr. Fabi, so nice to see you. Haven't seen you in a while.
It's lovely to see you. Thank you for having me.
Absolutely. The big question is, of course, is who? Who is currently available to get the vaccine and who's eligible in the next phase?
So right now, all tiers of phase 1A are eligible to receive the vaccination. So that includes all healthcare workers, as well as residents in skilled nursing facilities or assisted living facilities, as well as those that are age 75 and older as of the 18th of this month. The next phase will include 1B. And so those are persons that are greater than 65 years of age, as well as those that are in high-risk jobs, which include education, like teachers, as well as emergency services personnel, and food and agriculture. So those in the businesses of food and delivering food, as well as many restaurants. And then from there, we're going to be going on to Tier 2 of Phase 1B. And so that will include the industrial communities, commercial communities, sheltering facilities for a lot of our homeless people in San Diego. And then we're going to be moving on to Phase 1C. And that's when it's going to really be opening up depending on vaccine availability. And so that will be those that are between the ages of 50 and 64, or those that are between the ages of 16 and 49 that have an underlying medical condition.
So if you are eligible, Dr. Fabi, where can you go in San Diego in order to get vaccinated, and how do you go about that?
Yes, so you can basically go to the San Diego County website, which will give you a list of the area or the locations that you can get vaccinated at. You have to make an appointment. Right now, we know of Petco Park being one of those sites as a superstation. We also have Rady's Children's Hospital, Sharp, Coronado, as well as Sharp, Grossmont, and then there's the county locations in El Cajon, as well as Escondido and Chula Vista and Imperial Beach.
Well, the state initially paused using a batch of Madera vaccines after they were reporting some adverse reactions. So now the state says that there's no link, and that's been stopped. They are allowed to use that batch once again. You know, we've seen people here in San Diego get it, including providers. They've been green lighted. What should people, you know, who are concerned about potential side effects know about both vaccines?
Well, the common side effects are still muscle ache, soreness, especially of the arm that you might get vaccinated in, as well as some people do spike with a fever and then chills. An allergic reaction, Moderna did not report, or there was not clear data on how many experience severe allergic reactions or allergic reactions in general when you look at the Moderna EU pamphlet. All we can really take away is from the Pfizer study, and from there we saw that about 143 of the over 14,000 that were vaccinated had some type of mild allergic reaction. And 111 of the placebo group also had some type of allergic reaction that was deemed allergic reaction, but nothing that was severe. And so Moderna does state clearly in their drug pamphlet or their vaccine pamphlet that everyone who's giving the vaccine should have some type of emergency allergic reaction kit to administer if anyone demonstrates an allergic reaction. And that's why most sites are actually monitoring you for 15 to even 30 minutes after getting the vaccination to ensure that you don't have an allergic reaction.
So that's like EpiPens, Benadryl, those kinds of things, just in case. Anything topical that you can put on if your arm is really sore. Obviously, a lot of people reporting that. Is that a problem if you put anything on top of that site where you got injected?
I haven't seen, I've had a lot of colleagues get vaccinated because we're obviously in Phase 1A, and I have not had anyone say that they've needed to apply anything. In the trials, they didn't apply anything, and it's really injected into the muscle, and so at that point, it might be ice that will help with soreness, but nothing really from an injection site reaction.
And very quickly before you go, those people who have received 2 doses of the vaccine, they should still wear a mask, correct?
Absolutely, because what the vaccine is helping prevent is you from getting the infection, the person who's getting vaccinated. We still don't know what the ramifications are of whether you can carry the virus still in your nasal cavity, and you can still spread the viral disease even though you're not necessarily infected. And so until we elucidate that, the CDC is still recommending that people wear masks, they practice social distancing, they continue to wash their hands. And so until we know more, those steps are all still recommended.
I mean, vaccines are really there to help kind of boost your immune system, to help you fight off anything. It doesn't guarantee you won't get it, correct?
Exactly. So even in the trial, there were still a subset of people that still got COVID, even though they were in the vaccine group.
Dr. Fabi, we know how busy you are. We appreciate your time always, and thank you for clearing things up for us.
Thank you so much for having me. Have a beautiful evening.
You too.